My story is a little bit interesting. I've got a medical family, at least a family that was interested in dentistry, and I wanted to do nothing like that at all. So I decided I was going to go to law school. And then I started thinking, gosh, medicine's equally interesting. Maybe I can get a dual degree. And so I was going to be an attorney that had a medical degree. And then I worked in an emergency room one summer, and I said, this is really fun. I really like what doctors do. And researching what attorneys do with medical degrees and what doctors do with law degrees, it was like, there's no reason to get a law degree if I'm going to practice medicine. And I decided to change my mind and go into medicine. Well, urology is an interesting specialty in that you are a surgeon and you get to take care of patients, but it's not all in the operating room. You have a continuity of care. I mean, I've been in practice in town for almost 30 years now, and I've got patients that I've taken care of for 25 to 30 years. Whereas if a urologist does surgery on somebody, say prostate cancer, kidney cancer, you follow them for the rest of their lives. And so you get to know your patients very, very well. And you sort of have a relationship that a lot of surgeons don't. The other thing about urology and urologists is that we're very much at the forefront of technical advances in medicine. You think of urology, well, you're just a bunch of plumbers. But realistically, the first people to use scopes were urology. The first people to use the robot were urologists. The first people to do surgery outside the body, breaking up stones, were urologists. So it really is a cutting-edge type of specialty, and it's not really recognized that way. The other thing about being a urologist that's fun is that you take what you do very seriously, but you don't take yourself as seriously as some other, let's say, surgeons do. You've got to sort of have a sense of humor to do what we do for a living, dealing with the parts of the bodies and types of questions we deal with. And so you've got to have an empathy and sort of a little more of a common touch to be able to pull it off. My goal for patient care is for them to be comfortable. When a patient comes into your office, they're scared. They're scared it's the worst. And so you need to let them know that generally their fears really outpace what reality is. Life in general is never as bad as we fear nor as great as we hope for. And so we need to sort of get there with the patient first. Once we get a plan together, then we need to go through it. And the plan may require tests, it may require surgery, it may require medications. We need to look at those from an individual standpoint. What is the stress of the test that you're going to put them for, the stress of the surgery? What's the financial stress on them? Is there a way to do this with a less cost basis for them? And so you've got to really look at the whole patient. So my goal for my patient is to essentially satisfy and relieve their fears, but to be honest with them at all times.